one of the most important things I've ever done in my medical career is hormone replacement. Women come into my office, men too, we'll get to the men, and women have a very well-defined, transition in their life called menopause. Menopausal symptoms can start way before menopause. It can start in your 30s. It can last till your 50s. But I alluded to this earlier on, and I alluded to irritability, loss of memory, weight gain, sweats. They're all listed on the board there. It just goes on and on and on. And most of these things are due to an absence or decrease in the hormones. The reason that women at 50 need to exercise an hour a day is because they don't have enough hormones. The reason that women get more wrinkles in their face than men do are because they don't have enough estrogen in their body. Do you know where men get their estrogen from? Testosterone. Okay? Every cell in the body that has an estrogen function has an enzyme called aromatase. And aromatase converts testosterone to estrogen. When we treat men with testosterone, their estrogen levels go up. In fact, we have to watch it. But women, when they get to menopause, and their ovaries aren't working, and their adrenal glands are kind of sluggish, and they have no place to produce estrogen, they have to rely on testosterone. Well, they're not producing enough testosterone either. And so, because of sun, being one big factor, of course, and dryness of the skin being another big factor, and not taking care of your skin being another factor, and the loss of estrogen, women develop more wrinkles. One of the things that men have going for them is that their skin, their beard, with their hair, gives them more structure in their face. And so men don't develop a lot of the loss of fat that women do. The beard helps that. But our objective is to make women's transition in life as pleasant as possible. And as pleasant as possible means taking away all these symptoms that I've just referred to, and many, many more. But there's another thing too. And the other thing is to keep it healthy and to cause no harm. So I have to talk about bioidentical hormones versus prescription hormones. Prescription hormones by drug companies are not natural. The reason they're not natural is that there's no profit in patenting or trademarking a medication that anybody can copy. And if it's a bioidentical hormone, except perhaps for patenting the delivery system, if it's a bioidentical hormone, they basically can't patent it. So what they do is they take the hormone and they bastardize it. So they add a methyl group to progesterone and call it Provera, or they take horse urine and alter it and call it Premarin. And almost everything that comes from a drug company is not a natural hormone. Now, is this important? You better believe it's important. It's important because the increase in breast cancer, the increase in uterine cancer, the increase in colon cancer have absolutely been shown to be related to primarily progesterone derivatives. Not so much Premarin. Premarin or what people do take, I mean, that's really not that bad. In studies of hundreds of thousands of women out of Europe, where they can control the medications that the women are getting because of socialized medicine, they have unequivocally shown through sophisticated statistical analysis that if you take progesterone, now let's be sure we understand this, progesterone stands all by itself. Progestins, Provera, all the others are different. They're artificial. When women are on progesterone, there is no increase in any diseases. In fact, it is breast protective, it is colon protective, it is heart protective. And if you give them testosterone, it is equally protective. So we now see in the literature that there's an increase in Alzheimer's disease, there's an increase, a decrease in cardiac disease, especially heart attacks in women. And why do these hormones cause decreased heart attacks in women? Because the mechanism for heart attacks in women is different than in men. In men, heart attacks occur because of occlusion of a blood vessel by a calcium plaque or bleed into a calcium plaque or something like that. Women's heart attacks are caused by spasm. The vessels generally are pretty clean, but women's heart attacks are sudden, without any history of heart attacks, without a history of heart disease, with normal EKGs, with normal stress tests and so on. And what happens, the vessels, the muscles go into spasm, which is the same as occluding the vessel by a plaque. Well, it turns out that the smooth muscle of and the endothelial layer of the blood vessels of the heart contain estrogen and testosterone receptors. And these cause relaxation of these muscles, of the muscles, and therefore the vessels are less likely to go into spasm. So there are many, many reasons on what I call the outside reasons being the symptoms, and the inside reasons, the healthy reasons why hormones are good for you. They're only good if they're safe, and they are safe if given properly. Now, men, their symptoms are subtle. They become couch potatoes, they lose ambition, they lose the ability or the desire for sex, and that certainly happens with women too. They become not interested in life. We are fortunate to have quite a few couples in our practice, husband and wives, people in their 60s. The only sex they've had in the last 3 years is hall sex, where they pass each other in the hall and they yell at each other. Now, I can't use the words that they yell at each other, but that's as close as some of these people get to having sex, you know. Well, I swear to you, we have these couples and they have new lives. They just feel like different people. I can think of 2 women that visited me this week in our practice, and I'm going to be a little graphic for obvious reasons. When they first came to our practice, they were dowdy, they were unhappy, they hardly smiled. They've been getting hormone replacement with us for a year. Now they come in and wear low-cut dresses, their breasts are hanging out, and some of these women, and these are women in their 50s and 60s. You know, some young guy hit on me the other day. It is about the most gratifying thing I've ever done in my practice. Now, I've been doing hormone replacement for about 10 years. And 2 years ago, I changed the way I practice it. I did it the conventional way of using creams and some pills. But now I do what's called implants. And we implant a tiny little pellet in the buttocks, almost exclusively. And the reason I do that is multifold. One is that instead of putting the cream on every day, you can go 3 months without doing anything. With men, it's 4 months. The blood levels are very consistent and get nice and high. We have quite a few patients who've been on creams who just never attained the levels that they needed to attain to relieve their symptoms. So we get those symptoms. Now, we get those levels. Now, more often than not, if a woman is postmenopausal, been postmenopausal for a couple of years, I don't even have to do any blood work. I know they have nothing in it. You know, we sit down and we talk with them, and we listen, and I know they don't have basically estrogen, they don't have any progesterone. Of course, if you're not ovulating, you can't get progesterone, because progesterone comes from the ovulated egg, the second half of the cycle, when you ovulate. If you don't ovulate, you have no progesterone. And they have very, very low testosterone levels. Levels of maybe 30 to 40. My objective is to get a woman's testosterone levels to 250 to 300 to 350. I've had doctors who have written me and said, "What are you doing? My patients' levels are so high. Do you know what you're doing?" Yes, we do. Because the medical profession in general doesn't appreciate this, because they don't do it, okay? Why aren't more doctors into bioidentical hormones? Where do I learn as a medical student? I learn from medical books. Where do I learn as an intern or resident in practice? I learn from articles medical journals or learn from drug reps. Well, no drug company is going to go out there and spend $5 million and do a study on a medication or hormone that they can't patent. They're just not going to do it. So there's no input to the physicians as to these alternative ways of practicing. I was fortunate enough and open-minded enough to look into that. And believe me, I said earlier, I went to Duke. Duke's mission in life is to train medical scientists. Really not medical doctors, but medical scientists. And so I'm very conservatively trained. I just don't do anything that I don't know. And I do everything on myself that I offer to my patients. Now, thank God I'm not a proctologist. But honestly and truly, even when we did the diet, before we did the diet in our office, I did it on myself. I use testosterone, I have fillers, I have Botox, and I'm really only 80, 90%